There is not an ER nurse on the planet that's going to ask, what is the patient's diagnosis when a patient comes into the ED in distress? That is not their first question. That is not their second question. Diagnoses come after stability. Can they breathe? Is the blood moving? Are they about to crash? You do not need a diagnosis to act. If somebody rolls into the ED gasping for air, no ED nurse is going to say, hold on, we got to confirm whether or not it's asthma or pneumonia. No. They're going to slap that oxygen on. That monitor going to get slapped on. Access is started. Help is coming. ER nurses take care and treat the problems that's directly in front of them, not the diagnosis. ED nurses don't have time to memorize lists. Neither do you. They recognize patterns. So should you. They see distress, instability, compensation failing, early decompensation, and they act well before the disease is known. The diagnosis, we'll deal with that later. The diagnosis is always going to come most of the time after the nurse has already intervened. The ER nurse is going to catch their early decompensation. She's going to escalate when things start trying to go left. The diagnosis will come later to explain why she had to do what she did. So when you freeze on questions, please remember that question, what would the nurse do first? Or whatever variation of it, whether it's pneumonia, sepsis, PE, the response to the instability is the same. You attack the threat. Symptoms guide action. Diagnosis explains the action later. You are not going to care what the diagnosis is. You should not care now. You should care what bucket or master pattern that disease process falls in. Is it perfusion? Is it pressure? Is it metabolic? Is it electrical instability? Fluid shift? Fluid loss, fluid over. And all the things. The only thing you should be worried about is not preventing harm, not allowing the patient to escalate, deteriorate, die. That's where y'all get tripped up at. Seriously. Sepsis, heart failure, pneumonia, PE. Y'all hung up on these diagnoses. Now you panic. Diagnoses on an exam is background noise, a distraction. See, the test writers and your instructors already know that you chasing labels and diagnoses, so they use them to distract. Symptom progression. You have got symptoms. Are they unstable? Are they deteriorating? Are they dying? Attack the threat. I am Nisi G, your preceptor, the Shift Show, your clinical confidence coach. I just want you to be successful. Follow me for more.